Well, welcome. Tonight we're going to talk about an area that more and more people are learning about, more and more people are using, and frankly, an area that we should all be excited is available to us. But first, let's start with an introduction.
Very nice to meet you. Thank you for having me on the show. I'm Mark Fitzgerald, one of the urgent care physicians for Milford Regional Physicians Group. I work at the urgent cares in the area.
Now, fundamental question. What is an urgent care?
It's a great question. So the name urgent care really does evoke kind of a lot of different thoughts for different people. And what our goal in providing care is really to be able to give people care that they feel like they need right away, or if they have a problem that they feel like needs to be addressed sooner than they might be able to get cared for elsewhere. So urgent care really gives people the ability to access medical care, no matter who their PCP is, what their age is, and for the most part, what condition is that they want to get addressed by a provider. So it's one of these fairly newer types of care when you think about how long we've had primary care and an emergency room, like emergent care, in that it really can provide that level of care that could be addressed by either type of physician, but is available kind of on an as-needed basis.
Why do we have urgent care?
So urgent care came out of this need for really people who needed care as quickly as they could get it, or had something that came up. But it really was not something that needed to be seen in the ER. It was not an emergency, and because primary care providers can be so overburdened with managing chronic issues, and their schedules can be very difficult to manage while trying to incorporate urgent visits into it. So there's been a number of different types of urgent cares that have grown. Some of the first ones were standalone urgent cares. So offices that opened up specifically for anybody who needed to be able to walk in and get prompt care for whatever medical issue that came in. Over time, there's been an appreciation that if you have a group of doctors who are primary care doctors, and they are having a lot of patients who need urgent visits and can't always accommodate them, it is a wonderful solution to have an urgent care affiliated with their practice. So doctors who know the primary care doctors get to know their patients and get to see them in an urgent care setting, so that care that they need at any point in the day when they won't get the chance to kind of get in to see their PCP. And it's a really broad spectrum of care we're able to provide. So it's anything that can come up with your health, such as perhaps like a urinary infection, a cold, a sports injury, any concerns that you're having about your body that you say, I really want to get this addressed, and I think it needs to be something that's addressed promptly.
Well, you know, when I think about urgent care, something happens and I want to see a physician. Now, if it's for me, I'm a manly old man, I'll wait. I'm tough. But you know, my daughter hurts her ankle at a soccer game. I don't want to wait. I want somebody to see my daughter. And when I think about the state of primary care physicians, it seems like more and more of them have closed practices. They've hit the maximum patients and they're not accepting new ones. So you sit there and say, where do I go? I mean, I could go to the Taj Hopkins, go down to the ER and see Jeff and his crew, but that has some downsides. You know, if I walk in and I got a boo-boo and not something really bad, well, a guy with cardiac problems probably gets a little bit of attention first.
Absolutely, and there are many times, so ERs will always provide excellent care for patients who end up in an ER, but exactly as you're saying, an urgent care is really a great place for people who want the care but don't need that emergent level of care. Someone who's having a heart issue or concern of a stroke definitely needs to be in an emergency room where they can have a lot of medical equipment and specialty available to them. But an urgent care, like you're saying, for something like an ankle injury, there are so many advantages to that over an ER. From the medical standpoint, we often can get you in and out very, very quickly. We also have all the tools available to us to be able to appropriately and completely assess that type of complaint or that type of an injury. So like if we were to take your daughter for an example, let's say she injures herself at soccer practice and is having a lot of ankle pain. She can come in, we can get her seen usually very promptly. Oftentimes there's no wait, so she gets seen by a provider within a matter of minutes of coming into the building. We can assess her, we can get an x-ray, which we have right on site if we feel that that's needed, and treat her. And that treatment may be something as simple as suggesting ice and medicines to help with the pain, or an ACE bandage, or it may even be casting, which we can do there as well. And that for the patient, that avoids having to go to an ER where they might have to wait for several hours depending on how busy the ER is. And oftentimes there is a financial burden associated with going to the ER.
Often? $250 and $500 deductibles?
It can be substantial, and it's really nice that coming to our urgent care is very often like an office visit. So it's the equivalent.
I'm paying you most of the time my normal copay.
Exactly. So that's it's like an office visit. So going into an urgent care, you often would pay just the copay that you'd see for like seeing your primary doctor. But we can get you in. We have all these services right at our fingertips that we can use to assess and treat you with, and hopefully get you home feeling better very quickly.
Well, I mean, I could see, number one, it seems like your urgent care is the ultimate open practice.
Yes.
I don't have to call you and say, are you accepting patients?
Exactly. And it really is, so I can't overstate the emphasis of having a PCP, a primary care doctor, who can manage all of the chronic health issues that a person might be dealing with, and to keep an eye on their health. I mean, there's nothing that beats a PCP when significant and chronic medical issues come up. But we really have a nice ability to be able to deal with all of those acute things, the things that suddenly might happen, and anything you really feel like I need to get in to be seen here for this issue that's just come up.
Well, I mean, you've hit on something, because if I've got, I mean, when Milford, when we first started, you could trace most of our lineage back to 4 primary care physicians. You were Mastriani, you were Cicchetti, 4. One of those 4 brought you in, and usually if you did something silly, threatened to take you back out. But, back then, you were dealing with the same physician year after year after year. And they knew who was a whiner, who never complained, so if they're complaining, ruh-roh, something's up. So I can see, Dr. Carlson above you, upstairs in Hopkinton, takes care of me and my family. And then he sends me downstairs when I need a vampire or, some blood work, or somebody's going to harpoon me. But if something happened on a Tuesday that, like you say, is not a long-term issue, I absolutely have to understand that he's better off treating somebody along the way versus my boo-boo.
Absolutely. And one really amazing feature of the urgent cares we have in Milford, which is partly what drew me to this urgent care in specific, following my most recent job change, was that what's amazing is our ability to know a patient before we're even able to walk in the room, because we have access to all of the records from the Milford regional physicians. So, for example, a patient of Dr. Carlson's might come into our urgent care, and even if I don't know them, if I haven't seen them before, I have access to all of their medical records. And that's a little unusual for an urgent care.
Is it really?
Many standalones don't have the ability to access your medical records. And so if you were to go to one of the other urgent cares around our city or one of the cities around us, if it's not a Milford Regional Urgent Care, formerly Tri-County, they won't have the ability to know your medical chart, which is not as important as getting to know you in the visit, but is still extremely useful to be able to know all the background. So oftentimes when I go into a room with a patient who is a member of the Tri-County system, I can walk in and I can say, "Hi, I'm Dr. Fitzgerald. It's a pleasure to meet you. I've had the opportunity to look through your medical chart, so I know a little bit about you, but tell me what's bringing you in today. And I think that can mean the world to someone, especially someone who has many medical issues, but it's often very reassuring to everybody to know that as the provider coming in, that they're not a total stranger and they kind of have some information.
Well, it also keeps you from saying you're allergic to penicillin, or you know, prescribing something that, oops, maybe we shouldn't.
Yes.
And I remember Uncle Phil was so proud of his electronic medical records, you know, and when you look at how much he and Ed shepherded through to put that system into place, and now countless amounts of dollars with Epic, but it really is comforting to know that you can go back and snoop through files automatically and say, ooh, wait a minute, this may tie to that, versus let's start from square one.
Yes, absolutely. And oftentimes people coming in to see us have so much on their mind. If it's something like a bladder infection, a cold, or if they have a flu or a broken bone, oftentimes the last thing on their mind might be trying to recall all of their medical information. So it is a really nice foundation to be able to walk into that room. And I will often phrase something as like, I was looking through your chart and I noticed that you were allergic to penicillin. Are there any other allergies I should know about? And the patient there has the opportunity to correct me if that's wrong, but also to make sure that there might be other information.
Well, you said something profound, because when I come in, I'm not there because I'm feeling good. You know, and God forbid it's my child. Then absolutely, I will admit I am a basket case. When it came to my girls, you know, if it was me, it's like, okay, my wife would say, shut up and bear it. But the kids, my tension level is not at its lowest point to begin with.
Yeah.
Having you come in and say, I've looked at your records, I'm able to look all over, and I can, you know, see that Dr. Carlson said this, or that this was a concern. Is it still? Number one, I feel better, because this is not McDonald's, you know, where I'm in and out and nobody knows anything, you know. But number two, it's got to help the quality of care.
It absolutely does, and there's been for many, many years, but there's been this examination in medicine of what we call transitional care points, or points where a person's care is getting transitioned from one place to another, whether they're admitted to the hospital and going back to the outpatient doctor, they're seen in an urgent care going to the outpatient doctor, or they're going from the outpatient doctor, their primary care, to like a specialist. There is so much opportunity for there to be either miscommunication, lost information, and there's been a lot of research that has shown that that is a big problem point in our medical system. Most of our electronic medical records, which were supposed to be like this savior, didn't play out the way that they were supposed to, and we so often lose very important things in that transition. And even coming from a background of being a primary care doctor, I saw that, where sometimes patients would get discharged from the hospital, come back to me, and I wouldn't really have known what had happened to them in the hospital, and I'd have to get the story from them. That's not reassuring to the patient, and can be hard for me too to try to piece it all together in the 15-minute follow-up visit. And so it really is an invaluable thing to say, if we see someone in urgent care, to be able to make sure that we communicate with their physician. And really, the gold standard of that really is when someone is in the Milford regional system, I can pick up the phone and I can call Dr. Carlson, I can send him a message through the computer immediately after the appointment, and I can say, hey, listen, this Mr. Smith just came in for pneumonia. I really want him seen again in a week. We can either do it or you can do it, but I want to make sure we get him in.
Somebody does it.
Exactly. And even when patients are not in our medical system, the Milford regional system, they come from another practice and we can't see their medical records, we make a tremendous effort to be able to reach out to their PCP. We send all the records to their PCP. We'll oftentimes, if it's a concerning issue, call the PCP, and we'll make sure that there's some sort of communication to make sure that there's the follow-up that's needed.
But now, are there what, 6 primary care physicians that are not in the Tri-County system in Milford area?
It seems like that just about.
I was going to say, there's got to be half a dozen somewhere.
Yeah.
But it seems like every physician that is a primary care is part of this system.
Many of them are, and there are smaller groups which again provide excellent care that are not integrated into us. Some of them are affiliated with UMass, so we don't have quite the ability to integrate and get into their system. But still, absolutely the ability to see those patients and communicate with their providers. Everyone in our urgent care network has had a career prior to coming to urgent care. So some of us were providers in an ER, some of us were providers in a primary care office, and we all understand that importance of communication, and we're all experienced in knowing what needs to be communicated. And so we really work hard to make sure, no matter even if you are with one of those PCPs not in Milford Regional, that there is that communication that occurs.
But now, let's just be candid. PCP, you could work anywhere. I mean, year after year, Phil and Ed come on and they keep saying the hardest thing they have is finding good PCPs. Why urgent care?
That's a great question. So I was trained in family medicine out in UMass Medical School.
All the way out in Worcester.
Yeah, and my family and I live in Milford with my 2 young kids. And when I started being as a family medicine primary care physician out in Worcester. So I took care of full spectrum from birth until death, and I loved that. I really, really enjoyed it. The trouble with primary care is it is a lot of work in our current healthcare system. There's a lot of paperwork that goes into it. There's a lot of really working on how to be efficient in primary care. And there are a lot of doctors who are very good at it. The challenge that I was running into was that I was part-time, but I felt like I was doing full-time work, even just only being part-time. I found myself working 9 to 5 and getting home and having 2 to 3 hours of work to do when I got home to finish my documentation, to do paperwork, everything that can come along with our healthcare system, which is mostly papers and administration nowadays. So for me personally, I went to urgent care for partly the work-life balance. Again, as I said, I have 2 small kids, 1 and 3, and it was very difficult for me to come home from the office and to say to them, I can't be dad, I still have to be a doctor. And coming from a family where my dad was present a lot, that was very difficult for me. And so the initial motivation for me to change to urgent care was that it was going to be days where there's much less paperwork in urgent care, just the nature of the beast in some ways, but that the days would be longer, but I'd have more time to be stay-at-home dad. So that was my initial motivation. Now, having been in urgent care for a while, it really is a rewarding field where you have people that come in and often are not feeling their best, and there's a lot you can often do no matter what it is to help them feel better and make sure that they know that they're getting the care. Part of what's really impressed me about the Milford Regional system is if you look at the Milford Regional Physician Group mission statement, says that their goal and their mission is to provide care to all members of the community and care that is dignified, compassionate, and respectful. And that's right on their website. And I've been so impressed with how much they follow up with that mission statement, that really all the doctors I've talked with have been wonderful doctors to make sure that they take good care of their patients, but also just in professional communicating, making sure that I felt welcome coming into this system, and that I was able to provide the best care that I could in the team that we all are.
But you had a blind taste test, didn't you?
I did. So I did very minimal urgent care in my primary care job, but I getting to come in and getting to see what it was. Well, let me kind of rephrase that too. Prior to coming to the Milford Regional system, we had a moment when my son ended up in the emergency room in Milford Regional. And it was very unexpected, and we rushed home to be there with him because he was with another family member at the time. And getting into the ER, just like you said, my attention level was through the roof. Like, I could have any medical problem wrong with myself and I could deal with that, but when it's your kid, you're just, your nerves go haywire. So I have never driven so fast to get to Milford Hospital as I have that time. And we got there, and no one in the ER knew who I was. They didn't know I was a physician. They didn't know that in a couple months I'd be joining their group. But I felt like I got VIP care walking in there. The doctors and nurses and staff, every single person was just phenomenal with my scared to death 2-year-old who did not want to be there at all. One of the nurses came up, gave him a teddy bear, was wonderful with him, and by the time we were leaving, I thought, this is such an impressive place to get care. And if I get to be part of this group, that is phenomenal.
And that's amazing because, you go to the ER, and yes, they can tell you what you're going through is not as critical as there are 4 people next to you with broken bones and lacerated, and you sit there and say, no, you don't understand, that's my son.
Yeah.
That's my daughter. There is nothing more critical in the world right now in my mind than when she looks up at me and says, Daddy, make it better. And it's got to be worse for you because you're a physician.
It's any parent who goes through that is...
Yeah, but I can't do anything. Yeah, I'm in the ER. I mean, I can see you sitting there saying, wait a minute, just give me a room and get out of my way. I'll take care of it.
A lot of us, I was talking with a colleague of mine, he also has a son under 1 though, and we were saying we really try to turn off, when we're being parents, we try to turn off the medical piece of it, and we say, let's let someone else manage it, because we'll be there worrying about everything it could be, and we said we need someone to approach it objectively. What's wonderful is being both residents around the area is that we know that when we go into the Milford system, we'll be getting good care. Someone who has the objective sense, but is providing good objective care to our kids. So we can provide the love and the fear and the anxiety while they're there. But
you can be a parent.
Exactly.
You can be a parent. Okay, my job today is to be dad.
Yes, absolutely.
It's got to be twice as hard because I know what questions I want him to ask. Why aren't you asking this?
And it's nice though. It gives you the break to really be there. So like when my son ended up in the ER, my job was just to sit there and make sure he was okay and try to comfort him. I didn't have to think of any of the medical stuff, and I knew he got good care there.
Now, you've been from Mansfield to Worcester, not a huge circle, but you ended up here at the center of the universe.
Yeah.
Why Milford to live?
That's a great question. So there's a number of pieces that go into that. My wife works in Natick, and as I mentioned, I worked in Worcester. So part of it was when I was in residency and medical school, after we got married, we lived in Northborough together. It was sort of on Route 9, split between the 2 cities, so that was pretty convenient. But when we were looking to buy a house, we said, boy, it would be nice to get something where we have still kind of equal distance to be able to travel, but something in an area where we know a little bit, that we kind of know the community we're moving into, we've seen a little bit, we've maybe at least visited the town. We had been in Milford several times. We love the restaurant Prezzo. It's where we went right after we got engaged. And so we knew that. We knew a little bit about the stores around the area. We had friends who'd moved in the area, or at least rented in the area. And it seemed like a really great place, and it seemed like the community had a tremendous amount to offer and really is very active and cares about the whole city and everybody in it. And so when a house hit the market at the time, my wife went to see it and she said, this is beautiful, it's exactly what we need, like it would be perfect for us. And so I came home from work one day and found out that we put an offer in a house sight unseen. But she made a great decision, and it was a community where we said we have access to Boston, we have a great medical system. We also have a 24-hour CVS right at the foot of the street, which is wonderful when you have young kids because it's only midnight when you need something. So it has everything that a young family might need, which is wonderful for us.
Well, some of us really like Milford. I grew up, as a matter of fact, grew up at the edge of the hospital property.
That's pretty cool.
Ended up being born in the Little Red Hospital, the Little Red building that was Milford Hospital, and did what every Milford kid wants to do, run away. I ran to Worcester, to Holy Cross, then to Washington, then to Paris. But when we had children, all of a sudden that gravitational pull, I want to be back at the center of the universe, where I really know the people and I really feel comfortable about the environment. So we moved back 28 years ago, and here we are.
I can understand the appeal and wanting to come back. Just getting to see, and now having lived here for going on our 4th year, it really has been a wonderful place for my kids to grow up. Just everything that we could ask for is in the area. And what's really impressed me is seeing the effort that's put into the community and the people who are here who really, like for example, Phil, who is CEO of Tri-County Medical Group, who's a Milford resident, and getting to see that growing up in Milford, being from Milford, like you have everybody who's been part of the town has worked hard to make the town a great place to be.
Well, he's still on the finance committee. He's lost his title, though. He's no longer Phil the CEO. It's now Laura's father.
Oh, okay, that's good.
Because his daughter, who's a crusader, just won an election to the school committee, so we laughed and said for years he was known as Signora Say, his wife, his husband. Now we said, now you're even demoted. You're just Laura's father. So,
I figured that was coming.
but it is something that people take pride, and when you think about it, this will be the 12th year in a row we have a surplus.
Yeah.
And at the town hall, I'm really proud of the fact we don't allow profanity inside the FinCom meeting, so no words like 2.5 override, debt exclusion. No, those are too profane. We don't use those words. And the only way we get there is that every department head feels like you're talking about, this pride of our little town. And I joke and call Milford the center of the universe, because I say 28,000 of us know 6 billion need to be educated. So now, if I look at going to the urgent care, I mean, obviously convenience, because I can't just drop in. Not knowing Dr. Carlson, he'd never say no, but it's not fair. He's dealing with people who are sick. If I got a small thing that you can take care of, being able to just drop in is wonderful. Not going down and see Jeff Hopkins, knowing that there are really sick people, and not only am I going to pay a $500 deductible, youch, and I mean, for a lot of people, that's serious money. It's not a joke to lay down $500. But do people start using you as their PCP?
That's a great question, and it has come up from time to time, and it is wonderful. In some ways, it is wonderful to get to see people again. I've had a couple people who I've seen a couple times for different issues, and I always joke with them. I say, it's great to see you. I said, next time I see you, I hope it's at the supermarket. But we have had that situation where we have had people who say, can you manage my diabetes? Can you do my blood pressure? And we really try to explain to them to say, we can make sure there's nothing going wrong. Like if you are worried about your blood pressure being too high today, like it seems very out of the normal for you, you can come to see us and we can make sure that it is a safe level for you right now. But on a long-term basis, it's really good to have a doctor who knows you and can schedule you in and make sure that they kind of follow up with you and have that long-term relationship. And that's a challenge for us to do in urgent care because we don't schedule appointments. We're really meant.
And that's the question, because okay, David is a crusader, so he gets 1 purple point. But you're a family practitioner. He's a family practitioner. Wouldn't I get used to you?
So it's a great question, and we hope that people, when they come to see us, they feel like it's their PCP, like they had that relationship where they say, and I've seen parents who come in to say, we had such a good experience here with our kids, whoever we saw, we're coming back for ourselves, and that means a lot to us. It means a lot that people have such good care in an urgent care that they say that's where we want to be, like our urgent care, and in some ways we can be sort of like the urgent care PCP, like when you need stuff urgently.
But it seems like you could be my non-urgent care too.
It would be a privilege to be able to do something like that, and it's just that long term. It really is important to have that doctor who can manage medications that need long term management more than kind of what we get used to. I mean, we get used to a lot of the antibiotics, a whole spectrum of medicines, but there are medicines like a lot of diabetes medicines, insulin adjustments, things like that are best managed by a primary care office that's had a ton of experience doing that. So there are those things that really are best managed by doctors who are ongoing and doing it.
But isn't it more that to make the urgent care efficient, you're not there Monday from 12 to 4 and Tuesday from 4 to 7. So I can't say, when is Mark going to be there? I'd like to make an appointment with Mark, and all of a sudden Sally shows up and it's like, you're not Mark.
That's very true too, is that our schedules, we have 8 providers at the moment who go between the 2 different sites. And in the Milford Tri-County Urgent Care, so the one right down the street from us here, it is ER physicians that staff that clinic. And it is a rotation, so you never know who you're going to walk in to see. And we all communicate. I mean, it's a wonderful team. We all know each other super well, and we will often, sometimes if one person's seen someone who comes in, they come in with something, sometimes we'll message each other and touch base and say, hey, you saw this person before, they're back, and I just asked you what your impression was when you saw them. But that's a very good point, is that we're rotating between 2 different sites. We work on average 3 days a week, so it's like a 1 in 7 or 1 in 6 chance that we might be the day.
Well, I mean, I can see, I go to Dr. Carlson, and the price I pay is that I have to schedule, because he's taking care of sicker people. You know, and you mentioned diabetes and all. Yes, I'm a rotund old man who should take better care of myself. Yes, I've gotten the lecture, and now my darling bride's got me on a dog food diet, this carbohydrate-free. The food's good, but it's dish big. Problem I have is, God dang it, it works. You know, my blood sugars for the first time in years are right at where they should be, and I'm down 12 pounds. It's like if it didn't work, I could tell her, see? Leave fat old men alone. Let me keep eating the stuff I shouldn't eat. So now I got to look at French fries and say, oh, those were the days. But, you know, to be able to just blow in at the last minute, the price I pay is that there's a group of 8, all equal, and they rotate.
Yeah.
So I'm never going to get David or Sally or Joe every single time.
Exactly.
Whereas if I want David, if I want Dr. Carlson, I get him every time, but his practice, I may have to wait 3 weeks, 4 weeks, if it's not critical.
Yeah. And the other thing which you'll find out is a lot of people will often call their PCP and ask them about what they're experiencing, and the PCP will actually say, you know, let me get you in if I
go downstairs. If I can't take you,
yeah.
Go downstairs, or
yeah.
Let me get you in now.
Yeah, and that's a major vote of confidence, as we're seeing that more and more as we've grown and taken on more providers, is a lot of the PCPs feel extremely comfortable and confident in saying to someone, go see our urgent care. Like, I know you'll get taken, you get excellent care down there, and I know that that's what I would, like, that's the best that I could ask
And I
for.
think that's something that's come up, because initially, people, I know the people I talked to were worried. If I go to urgent care, is that like the JVs? You know, are they real doctors? Or are they practicing? You know, do I get the same level of care? And I think it was absolutely amazing to people that they go to the urgent care here in Milford. Wait a minute, you were in the emergency room last week. It's the same level of staff. It's not like junior versus senior.
And you know, that is, I think that's true. A lot of medical fields kind of go through that growth period where they get that reputation. Being in family medicine, which has really gained in popularity and respect in the last couple decades, like since the 1960s, I'd say it kind of had that same reputation where it was not taken as one of the more serious medical specialties. Now, of course, it is a major one where people really know that they're getting good care from a family medicine physician. But you're absolutely right. Like, urgent care being on the newer side, I think there has been that stigma of, am I getting as good care as I get from my own doctor? And as I touched on earlier, all the providers in our group have had careers before coming to Milford Regional. Some of them were in other urgent cares. Some of them were ER docs, or ER providers, like myself. I was a primary care doctor. And what's amazing is we all bring our expertise from our different specialties and grow and develop in this group that really can provide excellent care for many different facets of the medical care you might need. And we have a meeting once a month where we sit down and we talk amongst ourselves as providers to ask ourselves the question, are we providing the best care that we can? Or what do we need to do differently to provide even better care? But I want people coming in to know that the care that I give them, that any of my colleagues are giving them, is just as good care as they would be getting anywhere else.
And I think that's the key, because if somebody said, why are you in urgent care? It's a lifestyle choice. Because you know, if you went to Jeff and said, I want to work in the ER, well, you did before. Okay, we'll change your rotation. You'll be an ER doc. You know, and then you'll go down to urgent care on these days. So I think it's really important that people start understanding that the level of physician is the same.
Yes.
In many cases, Milford system, it is the same physicians.
Yeah. Now,
Another thing people worry about is, well, if I go to your place, it's urgent care. I said, we just spent $50 million on Jeff's place, the new ER. When I need an x-ray, is it somebody with a candle and some tin foil?
No, what you'll find is all of like the X-ray techs, the staff that we have, they often float among the hospital, among primary care sites. So you're getting the same staff and support and nursing and provider levels, no matter what level of caregiver you're looking at. We're all could be equally qualified to be working wherever else.
But how about the equipment?
The equipment is the same thing that you'd be getting. So like an X-ray you get in our office is going to be just as good as one that you get in the ER in the hospital. There are things that we don't have access to in urgent care, like a CT scan or a CAT scan, an MRI.
But neither does Jeff.
Right, so like PCP officers might, and that's something that they'd have in the ER. So they have those ability to kind of have a couple extra tools at their disposal.
But if I go into the ER and I need a high-level scan, either you're scanning my cat, you're scanning my pet, whatever you're doing, that's not in the ER. Jeff sends you to the other department, right?
Yes, yeah.
And I go to specialists. Okay, so the difference is, do I walk across the hall or do I go from here up the street?
Right. It's so urgent care is a great place for a lot of complaints that come up. And one of the things that I like to emphasize is if we don't know if we can provide you the care you need, like there is sometimes a step where we triage. Like we see people come in and they, sometimes I might see an adult and they say, my abdomen really hurts. And I'll say to them, you know, I know it's unusual for an adult, and this just happened the other day, but I'll say, you know, I'm worried about appendicitis. And I was like, I can't take care of that here in urgent care. We need a little bit more tools at our disposal. And so I will then say, you know, if you go to the Milford ER, I can call them and send them a message through my computer, letting them know that I saw you, that I'm sending you over for this reason. And for this person that this happened to a little while ago, it was that exact situation where it was an adult with appendicitis, very unusual, but they got into the ER, got taken care of very quickly. They had a heads up of this person coming in, what I was worried about, and that they'd already been assessed, and got taken care of. So there's a lot we can do in an urgent care to take care of a lot of things, from mild things that come up to even more severe things.
Well, but I mean, we just talked to two new people that are surgeons that joined us. And, you know, it's always funny when they say, yeah, well, we do brain surgery, but the real tough one is the spinal surgery. I'm sitting there saying, what, brain surgery you consider not as tough? But, you know, it was amazing because it sounds like the same with you. They could take care of 90% here, but they absolutely had access to that one little sliver that if they needed it, they got the full force of Brigham and Women's or Dana-Farber or whoever for cancer.
Yeah.
That can be brought to bear to help out a Milford resident.
Yeah.
And it sounds like the same for you, that you take care of 90%. If you sit there and say, ooh, that could be surgery.
Yeah.
Okay, so you're the 1 in the 100 today that we're sending, oh, go all the way up the street.
Yeah.
You know, or, oh God, you're in Hopkinton, that's 3 whole miles we have to drive you.
Yeah, exactly.
You know, so from that end, it sounds like I really can't lose for going to urgent care.
Right, and I tell people that, and I try to portray that as there's a lot we can do. If it's one of these few things that may fall into that 10, 5, 1%, that is something that we're not, that an urgent care would have challenge managing in an office isolated from a hospital. We'll tell people that, and sometimes we do run into those things, like if someone comes in with chest pain, we can say 99% chance it's probably not your heart, but we really need the extra tools available in an ER to rule out that.
We're not going to take a chance that, you know, the good news is 99% of the people survive this operation. Bad news is you're the one that breaks the curve.
Yeah, and I tell people that. I will say, I'll say, you know, there's so much I can do here, and here's everything that I'm worried about, the things it could possibly be. As you can tell from all these things that I'm telling you about, 90% of them are not concerning, but there's that one thing that I can't tell you it's not, and I say, if you were my parent, I'd be telling you we need a little bit more workup to figure this out. And I try to really, and I tell people I don't like sending them to the ER, I try not to. I've been there as a patient, and I've worked in one as a provider, and they provide wonderful care, but if I can stay out of it, it's
But even
ideal.
then, if you did 8 tests, 8 steps, and you get to the point where you say, ugh, Jeff, I need your technology, I need your specialist, I'm sending them down.
Yeah.
Okay, so now I go up the street, and, you know, I've gone 500 yards, I say, hello, Jeff. I'm in the Milford ER. They're not going to repeat the 8 steps.
Right. So
it's not like I got to sit there and have them poke and harpoon me 8 times again.
Right. Yeah.
I mean, you're one of them. You know exactly what to do, how to enter it. He's just going to take that and now say, ooh, okay, that's the one area that, if I need to scan my cat or scan your pet, whatever, if I need a CAT scan, a PET scan, whatever, I'll deal with it.
Yeah. Exactly, and we will try our best when patients come in to see us in urgent care to take that into account. So if I see someone, let's say I get an EKG, which gives me an electrical picture of the heart and how the electricity is traveling through it, and how the heart, many things about how the heart is doing, and I get an x-ray, and then I say to them, I think you actually need more care in an emergency room. Milford Regional will have access to everything I just did. They'll be able to see the x-ray and exactly what you're saying. We can send the patient with the EKG, scan it through our system, and I will oftentimes say to patients, they'll want a lot of blood work. I could poke you here, but they might want something more when they get there. So I'm not going to get you here because my strong recommendation is that we try to poke you once and not.
Well, yeah, if I'm doing a panel.
Yeah.
Some of these panels that do 32 tests in 1 drop of blood,
Yeah.
1 vampire is better for me than 2.
Yeah, absolutely.
Right?
Yeah.
So if you can do 20 of the tests, well, wait a minute. They do 32 on 1 poke.
Yeah.
I'll take the 32 and not complain.
Yeah. Halloween only comes once a year. We try to keep it at that.
So now, what is the most frequent activity in urgent care that keeps you busy?
That's a great question. So there's a couple ways I suppose I could answer that question, and probably the most I could answer it as one way is the most frequent presentation or thing that we see. But the most frequent, another way to answer it would be the most frequent activity is being in the room taking care of a patient, which is part of what appeals to me about urgent care. Is there is so much of medicine that can be sitting in front of a computer doing paperwork, and what's really rewarding in the field of urgent care is the amount of time I get to spend in a room with a patient. It is by far the thing that I do most during the day, and that means a lot to me that I'm sitting there talking with someone in the room taking care of them face to face. There are a lot of complaints that we see very frequently, and we do become the experts at managing. So things like urinary infections, things like common colds, bronchitis, pneumonia, flu, tick bites, things like that. A lot of the things that we see around there, a lot of injuries. And touching on that about kind of the things that we can and can't manage in urgent care, is we can do a lot for people that get injured, whether it's a cut or a major major injury that breaks the skin, or if it's a broken bone, we can do a lot to work it up, get it stabilized, and then like in our Hopkinton office, we have orthopedics in the building with us, so we can say, here's their card, see them in a week, they'll have access to everything we just did, and it's amazing care, amazing follow-up with an orthopedist right down the hall. So you get the immediate care you need, which again, as we were saying, as a parent can be such a wonderful thing. Your kid breaks their wrist, we can take care of it, get them comfortable, get it splinted and stabilized, and then say, hey, we got these people right next door who you can follow up, orthopedic docs, who can get you in next week to follow up with this.
Well, and also, if there's 2 or 3 I'll get in trouble for calling arthropods, orthopedic surgeons in the building, you can choose to say, well, little Joey will do better with Dr. So-and-so, just personality, whatever.
Yeah.
You know them, they're in the building, you interact with them.
Absolutely.
So, a lot of compliance seems to be the interaction between physician and patient.
Yeah.
So you knowing who to send them to.
Yeah.
Or me just having to go, like when Dr. Carlson says, go downstairs, you need to see a vampire. I'm going to get poked.
Yeah.
Okay, but I just got to walk down the stairs. It's not like I have to drive somewhere.
Yeah.
Add insult to injury, I'm driving to be harpooned.
Yeah.
Okay, I could do without this.
Yeah, and that's in the urgent care. We have a book of referrals and specialists that we can do. So let's say they come in for an eye issue, and we do everything we can to manage it, but I say you really need to follow up with an ophthalmologist. I can give them all the names of the people in the Milford Regional system. So we have tremendous ability to refer to within the system to people who have access to all the records of their first visit.
And you'll know, do I need an ophthalmic surgeon? Is an optometrist okay?
Yeah.
You'll be able to tell me.
Yeah.
Who, where, when.
Yeah.
And then if I do need something, like when my eyes started blurring over and my surgeon looked at me and says, well, you got 2 choices. 1, I can take care of these cataracts, or 2, you can be blind by Christmas. I said, well, I'm not real happy about door number 2.
Yeah.
Can I have door number 1? And it did feel better that Dr. Kalwadi said, okay, we're going to the Milford Hospital, or Milford Medical Center, right? And it's like, oh, that's my hospital. Right away, my tension level is down.
Yeah. And as Milford residents will have seen, the growth of the medical center really is phenomenal. With the new cancer center they put in there across the street, many of the new PCPs that have grown up, that have been developing, and their practices that have been growing, the new urgent care piece of it, it really is a system that is trying to provide comprehensive care to the patients of the Milford community. And as I touched on earlier, the ability to kind of have knowledge of that whole system, where it is a big system, but it is one where you feel like you know the people in the system, the other providers, is really amazing. And it's really the growth of it over even the last couple of years, but longer than that. As you mentioned, the whole city kind of started out with like 4 primary care physicians. To see it grow to what it has is pretty amazing. And the other thing is to, like, for example, our name change from Tri-County Medical to Milford Regional. The main reason for that name change was so that people would know that we were affiliated with the hospital and that we're one big group.
You're one big group
taking care of someone.
Yeah.
So it really is excellent care.
I never understood what this Tri-County meant. It's like, well, you're part Ed and Phil. Okay, they're shoulder to shoulder. Okay, so why is one called Tri-County? You're Milford.
Yeah.
One of the things people bring up is the burden that undocumented aliens have on our medical system. Jeff Hopkins, head of ER, has been very, very definitive on his opinion. What do you think?
That's a great question, and I'll first say I don't envy any president we have, Democratic or Republican, who has this on their plate to try to fix. It is a major challenge to provide the care, but also to be someone who is an undocumented immigrant trying to get care in our system. And we don't have a good system to deal with that. And I'm not saying that there's any right solution that I would be able to come up with, but I mean, healthcare really should be something that people can get when they need it. I mean, it should be something that there's that debate of, like, and a lot of doctors feel similarly, that it really should be like a right to be able to have a level of medical care to have good health.
See, I got a kick when Jeff said he swore allegiance to that Hippocrates guy.
Yeah.
So something about thou shalt do no harm.
Yeah.
And I was really impressed when he said, Al, I am need blind.
Yeah.
All I care about is the medical need. Whether they pay for it or have a Visa or MasterCard, once they get through to me, don't care. But the fundamental question is, are any Milford legal residents suffering because of it?
That's a good question. And so there shouldn't be that feeling that your care might be displaced because of someone else's care. You do hear a lot in the medical system about needing to, like, ration care and do things like that, and spend sensibly and really try to cut healthcare costs and spending. But there should be no point where someone feels like a person's status, whether legal, illegal, undocumented, is limiting the care that they can receive.
Well, after talking to you, I can see you follow the same logic as Jeff, that if there was a sick kid on the doorstep, you're not going to ask them, how do they pay?
Yeah, exactly. It's that is, I have a whole soapbox I could get on about insurance companies, healthcare spending, and what it comes down to is when you are a physician and when you're a patient, it really, like, that care should be about those two people, and there really shouldn't be anything money-wise that's playing into that. And when you go back to the roots of it, like the word patient means one who suffers, and we try to take that in medicine as we're taking care of someone who is suffering, and there shouldn't be any restrictions on, especially monetary-wise, on us providing that care. And so all of us feel that, I mean, if someone needs care, they should be able to get it, and that we should be able to provide it.
Now, in the urgent care field, you always worry about practicing defensive medicine. Because when you talk about healthcare costs, when I was running a clinical diagnostic lab, we saw panels of tests. And, you know, when you talk to some of the docs, you say, why? I said, because if I don't, and anything ever goes wrong, they can come after me. Is that getting any better?
That's a very great question too, and my hope is that it is. There is certainly, you have that element of feeling that way. I'm struggling to answer it because there are times we feel that way. Like there are times that we see someone and you feel like what level of defensive medicine do I need to practice? And ultimately, I think someday urgent care itself is going to become a medical specialty in the same way that primary care and emergency room care are two very different spheres. There's a lot that's very similar, but there's a lot that's very different about them. And I think we're growing to see there is this realm of urgent care where it's how defensive do I need to be? Like, what is good care? What is defensive medicine? How do I draw those lines where I'm not their PCP, so here's what I know about them, here's what I don't know about a person. Here's kind of the things that I can do that a PCP can do, that a PCP can't do, that an ER doc can do.
I mean, Dr. Kadis, Mona's taken care of my mother since she was diagnosed with intestinal cancer, 20 years. There's a lot of history that if she was questioned about treatment, she could go back decades. You've known me for 8 minutes. So, you know, it's got to be a lot harder on you.
And there is that challenge. And I tell patients, there have been times when I say, you know, I want to order this test. Let's say it's a person in their 70s who comes in with dizziness. And I say, you know, if I was your PCP, I might have access to your last blood test you got a week ago, but I don't. And so to really figure out dizziness and make sure that when I'm sending you out of here, it's not something that I have to be concerned about getting worse or being dangerous to your health, I might need to repeat some of the things that a PCP might not have to do. But so there is a level of it, but we try to make it very reasonable and informed care, and care that is safe, but also not just doing something just for the defensiveness piece of it.
Well, and again, it just shows you how important this investment that Phil and Ed are making in this new Epic system. Because if I go in and I'm part of the Milford, the Center of the Universe medical team, you do have access.
Yeah.
You can look up and say, ooh, Dr. Carlson said this. Ooh, I better be careful. Or, no, I can look back 5 years. Never been a problem, probably an anomaly. You know, we're going to let you go and check back with your primary care. You know, I think of the years of Fareem Farouk, who, again, was my mother's PCP for centuries. You know, when he retired, it was like culture shock.
Yeah.
Just the idea, we're not going to have Dr. Farouk anymore? You never had to explain anything. You walked in, he knew everything about you. Just like Dr. Cicchetti, when I was a kid, if you tried to fake something, he'd say, look at you and say, seriously? You want me to whack you? Oh, okay, you're right. So, you know, again, the urgency has a lot of benefits that I can walk in, you can take care of me, but as this grows into a specialty, and I really do believe what you said was profound. There are people, it's like in the biotech world, we have people who do well in startups. We have people who do fantastic in billion-dollar companies. They're different animals.
Yeah.
You know, so I can see somebody who wants to be a family care provider. You know, we got lucky and Liz Sirocco took my daughter on. And I kept being told by everybody she was the best in the area. You know, luckily she accepted us. You know, but there's somebody who you really feel comfortable. You know, you really feel like she cares. You know, when she talks about her patients, you know, when you talk about the practice, it's that passion. And when you feel the passion, the tension level, it'll never go away if it's my daughter. You know, even now at 31, something happens, I'm, you know, uh-oh, let's fix it. Tell me what I have to do to fix it. No.
Yep.
You know.
And that's, again, a big thing that drew me to Milford was when I was worked for UMass. I was trained through UMass. I worked through UMass. It was a great experience, and they give great care in the UMass system. When I was looking for that lifestyle change, I talked to one of my former colleagues who I trained with, Dr. Chantal Dewey, who's at the Blackstone Family Physicians, who came here out of her training, and Liz Sirocco, who was UMass trained, and they said, this is a great system to practice in. And I heard patients saying this is a great system to get care in. And I said, that's what I want to be a part of, is I want to be a part of a system that I know that what's important to me is providing good care for anybody who walks in that door, that's exactly the same page as everybody else.
But again, you get that balance. I want to provide good care, but I want to feel good about it.
Yes. Yeah.
I don't envy, I can't imagine a more trying position than an ER doc in a tough part of a big city.
Yeah.
Milford Hospital convinced me I'd never go in the medical field when I was in high school. We used to volunteer. And friends of ours came in, and one of them passed away. I said, that can't be me. I can't do this. Thank God there are people who can keep their calm, be able to talk to the family. But I knew right away, no, I'm going into business. It's a lot easier.
We have family members and friends of the families who are both police officers and firefighters. And it's always funny to hear the firefighters say, we think police officers are crazy because they could run into a house and someone could be shooting at them and dodging bullets. And the police officers say, we think the firefighters are crazy.
You go into a fire.
Yeah.
Didn't your mother ever teach you don't play in the rain, run away from fire?
Yeah.
Or if you're a police officer, run away from bullets?
Yeah. And I tell people, and I mean it sincerely, looking at careers in medicine, I knew from early on I really love medicine. Nurses are my heroes. I mean, they do so much, and there are a lot of things that a lot of doctors couldn't do that nurses can do far better than doctors. And I say to them, I mean, nurses really are phenomenal and are the angels of the medical system. And there's a lot of times patients will say, a good nurse will sometimes be more to me than a good doctor. And I say, I understand that. I totally appreciate where you're coming from. And I tell nurses, I don't know how they do it. The things that they do, but their job is phenomenal. And I mean, you really have this mutual respect of a lot of people in the field of like you're saying, like an ER doc. There's a lot of stuff in the ER that I don't know if I could do. Like someone coming in with a stroke. There is a level of relief that if someone comes into urgent care and I say, I'm really worried about a stroke, we got to get you to the hospital now. That it's going to someone who really can provide good care to them.
Well, even the nurses in Milford always had a sense of humor. Because back when, I always tell the story of, they used to allow 2 patients. This is the rooms where they had 4 patients. They used to allow 2 visitors per patient. Well, of course, welcome to Milford. All the Portuguese grandmothers have their own little internal mafia. So you'd go in, they had 2 cards they'd give you, and you'd go upstairs. And if somebody else came, you had to wait till the card came back, unless you're Portuguese. Then you called, and they opened up a back door. And I remember being inside the room, and there were 8 grandmothers there. And the nurse came in, starts explaining to them that you can't have 8 people. And immediately all of them said, no speaking Ingi. And I remember one of the grandmothers looked at me in perfect Portuguese, because I knew, my mother had been here 70 years. She can speak English. You rat us out, you die. So, it's always amazing, to see the quality of care. Just one more wonderful service by incredible people here at the center of the universe. We have urgent care facilities now in Hopkinton, right down the street from the hospital in Milford, in Northbridge, and they're going to be expanded. Get to know them. There's a lot of benefits and superb people and great equipment. So thank you.
Thank you for having me on the show. It was a privilege.
And as always, to our 6 loyal viewers, may God bless, and may tomorrow be a better night than tonight. Good night, all.